Welcome to my channel Medicine Guide. Topiramate works through several pathways. Studies suggest that topiramate can effectively reduce the amplitude and frequency of ET. Common side effects that may limit the use of topiramate for tremor include: topiramate is a useful alternative for patients with tremor who cannot tolerate. In this video, we will discuss how topiramate is beneficial in tremor. So let's start, but before that, please subscribe to my channel Medicine Guide. Topiramate, an anticonvulsant medication primarily used for epilepsy and migraine prevention, has also shown promise in managing essential tremor, ET, and tremors associated with other neurological conditions. Its effectiveness is attributed to its multiple mechanisms of action, which impact neuronal excitability and neurotransmitter modulation. First, we discuss its mechanism of action. Mechanism of action in tremor management. Topiramate works through several pathways that may contribute to tremor reduction. 1. Voltage-gated sodium channel inhibition stabilizes neuronal membranes and reduces hyperexcitability. 2. Enhancement of GABAergic activity potentiates the inhibitory effects of gamma-aminobutyric acid, GABA, decreasing tremor-associated overactivity. 3. Glutamate receptor antagonism, AMPA/kainate receptors reduces excitatory neurotransmission, which is often implicated in tremor pathophysiology. 4. Carbonic anhydrase inhibition modulates ionic balance, possibly affecting tremor generation pathways. Now have a look on topiramate. Clinical uses in tremor. 1. Essential tremor. ET studies suggest that topiramate can effectively reduce the amplitude and frequency of ET in some patients. It is considered a second or third-line option when first-line agents, e.g., propranolol, primidone, are ineffective or not tolerated. Typical dose range: 50 to 400 mg/day. Often titrated slowly to minimize side effects. 2. Parkinsonian tremor. Some reports suggest benefit, though data is limited compared to agents like levodopa. May be useful in levodopa-induced dyskinesia. 3. Medication-induced tremor. Has been used off-label to counteract tremors induced by medications such as lithium or valproate. 4. Multiple sclerosis, MS, related tremor. Limited evidence, but may help with action tremor in MS patients. Efficacy of topiramate. Clinical trials have shown that topiramate can achieve a 20 to 50% reduction in tremor severity in some ET patients. Response rates vary, and some individuals do not tolerate the medication due to side effects. Dosage and administration. Initiation at a low dose, e.g., 25 mg per day, with gradual titration over weeks to minimize side effects. Target dose: 100 to 300 mg/day, divided into 2 doses. Adjustments based on patient response and tolerability. Slow tapering recommended when discontinuing. To avoid withdrawal effects. Side effects and limitations of topiramate. Common side effects that may limit the use of topiramate for tremor include cognitive impairment, brain fog, attention, memory, and speech difficulties. Weight loss can be significant in some individuals. paresthesia, tingling sensations, due to carbonic anhydrase inhibition. Fatigue and drowsiness. Mood changes, depression, and anxiety. Kidney stones due to carbonic anhydrase inhibition, necessitating adequate hydration. Taste disturbances, dysgeusia. Contraindications of topiramate, history of kidney stones. Cognitive dysfunction or psychiatric conditions. Pregnancy, due to teratogenic potential. Comparative effectiveness of topiramate, compared to propranolol or primidone. Topiramate may be less effective but can be considered if patients have contraindications beta blockers or barbiturates. Combination therapy may be used in combination with propranolol or primidone for additive effects. Key takeaways: topiramate is a useful alternative for patients with tremor who cannot tolerate first-line medications. Titration and monitoring are critical due to side effects. Patient selection is key, especially in those with weight concerns or cognitive issues. Further research is needed to better define its long-term efficacy and safety in tremor management. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer: channel's intention to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide.